Hi, my name is Kylie. I'm originally from Utica, New York. I attended Moyne College for my Bachelor's of Science as well as my Master's in Physician Assistant Studies, and here I am to serve the community at CHC Gouverneur. So I've always been interested in science and medicine. I was the kid who had the microscope from the old hospital in second grade and was using my grandpa's diabetic lancets to look at my blood underneath the microscope. I would not recommend that as a kid, but I was always interested in that, and so that kind of fueled my interest into the healthcare field. And then when my family had some experiences in the healthcare field, both positive and negative, I realized that the PA profession was something that I was really interested in, and so I pursued that further. In high school I shadowed doctors, NPs, PAs, and then made my decision from there and attended Moyne College. So PA is an all-encompassing degree in itself. You don't really move forward or backwards. However, it does have a lot of lateral specialties that you can move into, a lot of lateral mobility. So I could theoretically move into a primary care aspect or an orthopedics or a different specialty of medicine. That is an advantage that MDs don't have the ability to do. However, in the PA profession, you're able to have that lateral mobility a little bit more. However, I've really fallen in love with the pediatrics profession, and I don't see myself changing specialties really anytime soon. I like that they believe in magic, and I think that you can see the beauty of the human body and its healing powers because of that. Kids are so resilient, and so you're able to see really from birth to almost full adult development how amazing the human body is, how much we grow and we develop. And I like getting to know the kids, I like getting to know the parents so I can better serve them, and following them all the way through is something that I really enjoy as well. I see ages from birth, usually that's right around the newborn appointment, to 2 weeks of age, all the way up until 18 years old. In some cases we do see a little bit older if you're transitioning in the college realm, still trying to find a primary care provider, but usually until 18. So I really follow a holistic care model that was instilled to me from my education. I really want to know who you are, how things are going on an intimate level. I want to know, are you experiencing any symptoms of postpartum depression, because that does impact the care of your child and the care that you will receive. How is the child really sleeping? How are they eating? What can you expect in the next 2 months? And how we can best prepare you, whether you're a new parent or an experienced parent. How best can we serve you and assist you at this time? Because it can be really hectic, and a new baby is sometimes anxiety inducing, and we understand that. So no matter how much information you want to get or how little information you want to get, just following that holistic care model. So I did a rotation in rural medicine, actually in pediatrics, and I fell in love with just what it takes to care for a rural community. There's a lot more creativity that's needed in some physical diagnosis skills because there maybe isn't as much access to certain testing. I liked the challenges that came with some transportation difficulties. I liked the small town aspect and community, and I liked being a part of that community where I could take part and participate in that community as well as care for that community. I really like to hike. I like to spend a lot of my time in the Adirondacks, which is super close to this area. I really like to go to the gym. I grew up dancing, and so that's still a passion of mine that I find ways to incorporate into my everyday life, even if it's just in my living room now, but still something that I grew up with and I don't think will ever not be a part of me. I think the most rewarding thing in my job is seeing a kid come back better. When they come in and they have an awful ear infection and they haven't slept and they're just absolutely miserable, seeing them come back and being back to their baseline and playing around again, I think is probably the most rewarding part for me. I know for patients, I really enjoy that patient care, and so getting to know you and your needs as a patient and as a parent is something that I really enjoy as well. And sometimes that includes just aspects of, hey, how was your Christmas? Or, you know, how did meet up with Grandma and Grandpa go? Or how are things going with your other children? Little things like that I think really make the difference when it comes to patient care. The most challenging, I would have to say, just being the fact that they are kids. Sometimes they're not able to tell you this exactly is hurting or this feels like this. It's more of a sharp pain versus more of an aching pain. And so I think kids are a little bit of a puzzle in that way, and so it is a little bit more challenging. But I think that's part of pediatrics that I like. I like a little bit of that puzzle. I like being able to use my physical diagnosis skills and using other aspects of just rather than conversation to try to get to the bottom of what's going on. So the area really appealed to me. Ancestrally, my grandma is Native American, and so the Adirondack region was something that was super important to me. Also, I just kind of fell in love with the community feel here. Every time I interviewed or reached out to somebody in the organization, it always felt like a family. I already felt cared for even before I was employed. And so for me, it just felt like somewhere I was coming home to, even though I wasn't from here. And so that really drew me to this area, and ultimately why I chose to work at Community Health Center of the North Country. And I really look forward to working with you, working with your children, and my philosophy on pediatrics really is that I will give you all the information, and you know your kids better than we do. You are with them day in and day out, and so we will give you the materials to be the best parent that you possibly can be, and you can make those decisions for your child, but we will be here every step of the way, regardless of questions or information that you need, or if you're just like, hey, I got this, I will contact you if I need you.